Welcome to our presentation on cardiac rehabilitation. I'm Arden. Tessa and Sara are going to be talking to you later, but for now, you guys got me. So what is cardiac rehabilitation? According to the American Heart Association, it is a medically supervised program designed to improve your cardiovascular health. If you have experienced a heart attack, heart failure, angioplasty, or heart surgery, you might need it. And we'll talk about what these things are. Okay. So these are the conditions that would benefit from cardiac rehab. As you can see, we have heart attacks, coronary artery disease, angina, congestive heart failure, coronary artery bypass graft or CABG, a lot easier to say CABG, arrhythmias, valve replacement, pacemaker, implantable cardioverter defibrillator, and stenting. We're going to cover all of these, so don't worry about memorizing them all right now. So a heart attack. As a lot of you know, it's pretty bad, but this happens when the blood supply to the heart is reduced or cut off, and that's in the arteries that are on the outside of the heart. And what happens is the heart becomes ischemic, and that's due to lack of oxygen and nutrients. This is due to the buildup of plaque, and a stat about this is every 40 seconds, someone in the United States has a heart attack. Angina is not a heart attack, it's just chest pain resulting from lack of oxygen. It's like a heart attack because plaque builds up but doesn't block off blood flow. Next, we have coronary artery disease, and it's one of the most commonly diagnosed heart conditions in the US. What happens with this is the artery will get plugged up with plaque and it gets blocked off. Just like in this picture here, you can see the progression of coronary artery disease. And this can lead to a heart attack, angina, or arrhythmia, which is an irregular heartbeat. So the next thing we have is congestive heart failure, and that's the heart's inability to pump blood, and it can affect one side or the other, or both sides at once. And so what this can do, it can cause the backup of blood and fluid in the lungs or in the legs and ankles because it's not circulating enough blood fast enough. And then you could feel a shortness of breath and fatigue because of this. This usually results from coronary artery disease, hypertension, and diabetes. Now we have the CABG, which is the coronary artery bypass graft, and it's a surgery to repair arteries. So the purpose is to improve blood flow to the heart because the arteries are blocked off, usually due to plaque. And they can use this in emergency situations like a heart attack, just to return blood supply to the cells. How this is done is they take blood vessels from one part of your body and link it onto a blood vessel before the blockage and then after the blockage. And they usually take these blood vessels from the arms or legs. And you can do this for one or more blood vessels, as it says down here. You can do it multiple places. All right, now we have arrhythmias. I had talked about this just barely. So there's a couple types. Arrhythmia just means an unnatural rhythm. The first type we have is tachycardia, which is a fast heartbeat, and how we have it defined here is more than 100 beats a minute. Bradycardia is a slow heartbeat. The definition we have is less than 60 beats a minute. Then there's premature heartbeats, like you get a heartbeat before you're supposed to. And how you can fix those is usually a pacemaker is implanted into the chest, like we see in our diagram here. And then the wires go in to the ventricle or atrium, depending on where it's exactly needed. And that sends a small impulse to get the heartbeat working right. And they're very good lifesavers. Another thing we're going to talk about is valve replacement due to dysfunction of a valve. And so as we can see in our picture, the dysfunction is kind of down here in the diseased aortic valve. It won't open or close all the way. And so we want it to look like this healthy aortic valve. So what this is the surgical repair or replacement of affected valves due to cardiac valvular dysfunction. And so they do that to make it healthier. And there's 4 types of valves that we can replace. We can replace the mitral valve, the tricuspid valve, the pulmonary valve, and the aortic valve. Those can be replaced, but the most common are the aortic and mitral valves. All right, so then we have the implantable cardioverter defibrillator, which is a lot like a pacemaker. But this is used for ventricular arrhythmias in patients who have suffered a heart attack. So it's more specialized than just a regular pacemaker. It's like a pacemaker, because it is battery powered and goes beneath the skin. It monitors the heartbeat and whether it's regular or abnormal. And then when it's abnormal, it'll send a shock to get the heart on the normal beat. And this works 24/7. And its purpose is to stop ventricular tachycardia or fibrillation. And it prevents death, just like a pacemaker. And the last condition I'll go over is stenting. So a stent is a little tube that's placed inside the artery to expand it and repair the blockage caused by the plaque. It can be metal or mesh or fabric, and it'll just turn into like a straw. And these are permanent. And to show how it goes in, we have this little diagram. They put the catheter in, they expand the artery and put the stent in so that the artery can have blood flow again. All right, and I will pass it off to someone else now.
All right, guys. I'm Sara. I'm sure you guys know that, or I hope so. But now we're going to talk about population groups and some other patient characteristics for the cardiac rehabilitation and other facts with respect to the heart. Okay, so within the US, 1 in 4 deaths result from heart disease every year. That is a ton, really. And coronary artery disease is actually the most common type of condition. So you're probably going to see a lot of people who experience this in the clinic. And the coronary artery disease is the leading cause of death for African Americans, Hispanics, and Caucasians. And it's the second leading cause of death behind cancer in Native Americans, Pacific Islanders, and Asian Americans. So now we're going to talk about how cardiac conditions affect the different genders. So men commonly experience their first heart attack at 65 years of age, while women are usually a little bit older. They usually have their first heart attack at 72. And since 1984, more women have died from heart disease compared to men, but they think that this is because women usually live a little bit longer than men. So for this. And now, as you can see, we have some maps of heart disease, specifically in the US. On the left, you can see the states, and it's the heart disease death rate for 100,000 people. So if it's a darker color, that means there's more deaths due to heart disease. And one thing that I found interesting was Idaho and Nevada have a higher death rate compared to the surrounding states. And on the right, you can see the different counties with heart disease. And where we're at right here in Pocatello actually is the darkest color, which is also something that was pretty interesting. Okay, so a little bit on the trends in the research. Our first experiment was the transcatheter mitral valve repair in the patient. So these patients in the experiment had previously been diagnosed with severe heart failure, and they also suffer from the backflow of blood of the mitral valve as a result of ventricular dysfunction. And so the backflow of blood is also referred to regurgitation, and you can see in the photo to the bottom left, there's a picture of a normal valve compared to one that suffers from backflow. And these patients in the experiment were identified as symptomatic in spite of going to various medical therapies. And the primary finding of this experiment was a device known as the mitral clip. And you can see a picture of the mitral clip in this bottom picture right here. It's about the size of a dime. And so this clip was used to repair leaky mitral valves in half of the patient population. And they discovered that the mitral clip actually reduced the death rates and the number of hospitalizations in the patient population with mitral valve. Okay, a little bit more about this experiment is there were 614 patients total. Half of them had the mitral clip and also standard medical treatment, and the other half of patients only received just the standard medical treatment. And within a time period of 2 years, 151 patients who did not receive the mitral clip experienced heart failure and were hospitalized, while 61 patients died. But on the other hand, only 92 of the people who had the mitral clip were hospitalized, and 29 died. So you can see there was a decrease in the number of deaths and hospitalizations due to the mitral valve clip. So now a little bit relating this to physical therapy. So now I'm going to talk about an experiment where an exercise-based cardiac rehabilitation was used in the patients with the transcatheter aortic valve implant. And so these programs basically included exercises, really common exercises such as walking, swimming, riding stationary bikes, and other movements to basically help improve muscle strength. And what they discovered was that these exercise programs improved the physical capability or the capacity of these patients with the clips. And how they discovered with this was the patients had a higher VO2 max. And what a VO2 max is the maximal oxygen intake a person uses while they exercise. And so if a patient has a higher aerobic endurance, it results in a higher VO2. Next, we're going to talk about coronary artery bypass surgery, an experiment that basically tested how efficient it was to have the veins of the legs compared to veins of the arm. So regarding coronary artery bypass surgery, it's more common to use the veins of the legs, also referred to the saphenous veins. And a new study published in the New England Journal of Medicine demonstrated that the artery from the forearm may actually be a little more efficient compared to the one in the leg. So they had different trials to compare these two. So in this experiment, there were quite a few patients. There were 1,036 patients in total, and the patients had lower rates of major adverse cardiac complications, such as heart attack and repeat revascularization. And the radial artery grafts were also linked to better rates of the arteries staying open after 5 years. So they didn't close up as easily. And also the patients had overall improved clinical outcomes in the cardiac rehabilitation process. Okay, so now we're going to talk about an experiment that dealt with the alternative physical therapy protocol for CABG surgery. And basically what this experiment did was it tested a ergometer-based program. And what an ergometer is basically a specialized exercise bike. So we had some people use this while the other ones just use a standard physical rehabilitation protocol. So there were 24 patients involved in this experiment. 10 of them completed just the standardized protocol, and 14 participated in the ergometer based program with the bike. So to decipher which program was more beneficial, more efficient, patients were asked to undergo a 6-minute walk test. And what they discovered was, on average, patients of the ergometer-based program walked farther than the patients who just had the basic physical rehabilitation. All right, now the effect of physical therapy on the quality of life after CABG. There were 50 patients involved in this experiment. They were between the ages of 60 to 70 years old who had previously underwent CABG surgery. So the patient population was split into 2 different groups. There was a PT group, and the PT group did 16 sessions of just the standardized PT protocol after this type of surgery. And there was also a control group, so they did not undergo any type of exercise program. So what they discovered during this presentation was the patients in the PT group considerably improved after PT rehabilitation, and they also concluded that these exercises reduced pain and depression in patients. It advanced the patient's capabilities to resume their daily tasks, and it helped to alleviate other symptoms related with the cardiac surgery. All right, and now the effectiveness of preoperative physical therapy. So this is basically going through an exercise program before actually having the cardiac surgery. And so they discovered that the utilization of preoperative treatments appeared to have compelling potential in bettering the recovery period of patients that underwent these types of surgeries. And they also discovered that it reduced the hospital stays after the surgery. It lowered pulmonary related complications as well. And each patient had an individualized care plan to help determine their needs, what they needed most. And they had a certain type of exercise prescription. But basically, with all of them, like all of the prescriptions, the intensity goal was 40 to 70% of heart rate reserve for 30 minutes. And they also had inspiratory muscle training, or IMT as an abbreviation, and other exercise interventions reviewed in the study. So the IMT programs were shown to help the patients overall improve in strength and increase their endurance. All right, are you here?
Hey guys, I'm Tessa. So I will be talking about the clinical competence skills that will be most likely needed for cardiac rehab. So the primary goals of a PT or a PTA regarding cardiac patients is gradually building endurance and strength of the patient and closely monitoring the patient's heart rate and blood pressure. And usually they're hooked up to like an EKG, which I'll talk about a little bit later. So therapy for this usually lasts from 12 weeks to a year. After 4 to 8 weeks, the patient will generally feel big improvement, more energy, and more strength. After 2 months, typically patients feels back to normal abilities, I guess, and feels like their old self. However, therapists must consider factors such as age and other problems relating to joint mobility. as well. So one of the things that happens during cardiac rehab is what they call a stress test, and it looks at how your heart performs basically. It happens on a treadmill. You're hooked up to an EKG. You have a blood pressure cuff on, and as you perform this test, incline and speed increase, and your blood pressure is taken throughout these intervals, and your pulse oxygen is also taken, which I will get to a little bit later as well. So they demonstrate how efficiently your heart pumps blood during physical activity. Stress tests also, if the individual struggles to complete the test within a certain period of time, may mean that they have reduced blood supply to the heart. They're used to diagnose cardiac conditions such as coronary artery disease, arrhythmias, and several of the other conditions that Arden talked about earlier. It shows the patient's risk of a heart attack, and it can also show if the patient has a heart attack or is having a heart attack. It also evaluates the effectiveness of heart treatments and determines what level of exercise is safe for the patient. So, like I said, an EKG or an ECG is a reading of an electrocardiogram. It measures the electrical activity of the heart, and it's important because you got to know how the heart is functioning during the stress tests and while they're performing their physical activity. It tells you how long each part of the heart is contracting or relaxing. So it shows if there is also previous damage. Like I said, a heart attack will pop up. The waves will look different if they've had a heart attack or if they've had ischemia. An ECG provides info about enlargement of the heart as well. If the heart is enlarged, then the waves will be longer to appear. And the graph below shows a typical EKG reading and what's normal, what's fast, what's slow, and what the heart is doing during each wave. So the next one is pulse oximetry. This is also known as pulse oxygen. So the little picture of the blue thing is the pulse oxygen reader. You just clip it onto their finger and it'll read their levels. There is also waveform, which is probably usually seen in hospitals along with like the heart waves. And so that graph below shows you what's normal, irregular, weak for pulse oxygen. It just measures the amount of oxygen in your blood, and yeah, it is important because it tells clinicians what the patient is, if the patient is receiving enough oxygen or not, and if they're not, then you definitely obviously want to stop exercise. I also included blood pressure in this slide, so I'm pretty sure everybody knows what it is. It's just the pressure that your blood vessels create it's the pressure in the blood vessels created by the heart. And it's important because you need to know the normal ranges. That way you can stop the patient if they're getting outside of that normal range, especially for them during exercise. And during exercise, it will be elevated because you're trying to get more blood to your body. So some common aerobic exercises are walking, riding a bike, rowing, climbing stairs, elliptical, and activities that just get your heart rate above resting heart rate. For cardiac rehab, you usually want to see the patient 2 to 3 times per week, and you can also have them perform some of these activities at home, and just you want them to perform them 3 to 5 times a day, like out of the week, and then 30 to 45 minutes for those intervals that they're performing that exercise. So the PT specialist certification is how you, I guess, become certified to be in cardiac rehab. So you must have certification in advanced cardiac life support. You also need to be involved in a research project linked to cardiovascular and pulmonary research within the last 10 years. And you also need to fulfill option A or B, which is 2,000 hours of patient care as licensed PT in cardiac and pulmonary rehab within 10 years, so 500 hours within last 3 years, or option B, which is completion of the APTA accredited post-professional cardiovascular and pulmonary clinical residency within the last 10 years. We also included the fees if you're a member of the APTA and a non-member of the APTA. So in conclusion, coronary artery disease is the most commonly diagnosed heart condition. There exists various conditions that could potentially benefit the cardiac rehabilitation. Physical therapy has proven to be beneficial after CABG surgery and transcatheter aortic valve implants. Current trends in research are focused on advancing cardiac surgeries and discovering alternative treatments that may also be profitable for cardiac patients. Cardiac rehabilitations aim to build strength and endurance in patients while closely monitoring vitals to ensure safety. Thanks for listening to our presentation. Hope you guys have a good Thanksgiving break.